I'd like to introduce Rachel Storm. She is a member of the board of the League of Women Voters of Champaign County, and she will introduce our forum.
I'm a bit shorter. Good afternoon. Thank you all for joining us this fine Valentine's Day. As Teresa pointed out, I am a board member of the League of Women Voters, and I work as the Assistant Director of the Women's Resources Center on campus. I'm excited to be able to help create a discussion today of local efforts of comprehensive sexual health education in our community. Today we'll listen to comprehensive sexuality and reproductive health educators discuss localized education efforts led by institutions in our community. We'll explore what current sexuality education exists in terms of resources and what they look like, what defines or constitutes comprehensive sexual health education and how that language is perhaps changing, and what efforts may have been made over throughout the past few years to secure these programs and resources in our local community. I hope this discussion will also serve as a space to envision the future of comprehensive sex ed here in Champaign County. And what better a day to discuss relationships, sexuality, and education than Valentine's Day. So thank you all for being here, and I hope you'll join me in welcoming Kathy Spiegel, Kim Rice, Barry Rothbaum, and Corbin Dixon. What we're going to do to start today is to just have each of our panelists take a few minutes to introduce themselves and their relationship to the topic of visions for comprehensive sexual health education in our community. And then we're going to go through some sort of facilitated questions. And at the end, we'll have some open questions for discussion. Anyone want to start?
I can start. Like Rachel said, I'm Kim Rice. I currently serve as the sexual health educator at the University of Illinois here in Urbana-Champaign. I've worked in the field of sexuality with college students my whole career, so for the past 16 years. I also serve as a training consultant for the Illinois Caucus for Adolescent Health, and in that role I go around the state of Illinois and provide trainings to middle and high school health teachers, social workers, counselors in the area of sex education that works, to provide them with curricula, skill-building training in the area of sexuality.
I'm Kathy Spiegel. I was formerly at Planned Parenthood here in Central Illinois. While I was there, I was Director of Education and worked specifically with the Teen Awareness Group, which does peer education in the schools. And one of the things we discovered at that time was that comprehensive sex ed was not exactly what we wanted it to be. So that's where the effort came from several years ago to look at how we could work with the schools to make it more comprehensive and attractive to the schools.
Well, my name is Corbin Dixon, and I'm currently the Director of Community Education for Planned Parenthood of Illinois. And I'm based here in Champaign, so I do community education for Champaign, and then I'll also oversee other education that happens throughout the state. My work started in 2005 when I actually was in the peer education program. And as a graduate, now I'm managing that program and other programs throughout the state. And I also focus a lot on health communication, specifically with our medical services related to training and things like that for our staff to make a more inclusive and comprehensive place for our patients.
I'm Barry Rothbaum. I currently work at the Infant Parent Institute. Before this, I started out, I'm a social worker and have worked in this community for the past 20 years. When I started out, I was in the public school, so I have a good feel for that. And then before I came to the Infant Parent Institute, I was at Champaign-Urbana Public Health District. And in that role, I was working with teenagers who were pregnant or parenting and helping them to make it through school because of the long-term outcomes and how much it helps them. And it was through that job that I started to be aware of how little knowledge, accurate knowledge there was out there and how little teaching was happening. And that's when the campaign for comprehensive sex education came around, and I was really glad to be able to join it.
Great, so we are going to encourage all of our panelists to feel like they can take this panel on organically. If you feel like you want to answer a question, or you don't have to go in any particular order, and if you feel like a question's been answered, you don't have to answer it. But we're going to start off with this question. We hear the term comprehensive sex education often, and I want to ask our panelists, what does this term mean to you? What can you tell us about this term and maybe what it has meant over time?
When I think of comprehensive sexuality education, it's all issues that have to do with sexuality, and that includes everybody, men, women, children, because we are born sexual people, and we deal with the issues around our sexuality from the time we're born until we die. Unfortunately, the information about healthy sexuality isn't always readily available, and there are a lot of taboos about speaking about things in families. So when we talk about comprehensive sexuality education, we're talking about everything that affects your ability to be a good, healthy sexual human.
I'll add to that from a health education standpoint. I see comprehensive sexuality education as being really evidence-based in social science, so that we're looking at curriculums that not only build over time and adding on lesson to lesson to lesson in terms of the curriculum, but that the curriculums that we're using to provide sexual health education actually do what they say they're going to do. So if that says that if the curriculum states they're going to delay the onset of sexual initiation, that we're actually seeing science and evidence that that's actually taking place. If the curriculum says that we're reducing the rates of pregnancy or sexually transmitted diseases, we have evidence that proves that. So nationally, we're sort of looking at how comprehensive sex education and abstinence only, we tend to get into a debate around language. And so in the field of sexuality, we've started to look at different language and talking about sex education that works instead of the label of comprehensive sex ed, which can sometimes lead to debate and strong feelings.
And it should be, I would add that it should be all-inclusive for all the audience types. And that's built into a lot of the curriculums, that it addresses that there are different audience types. For example, that there might be someone who's a gender and sexuality minority. Maybe they identify as lesbian or transgender. That curriculum, I think it's important that it's all-inclusive for all audiences, not just for one type of student. For individuals from different backgrounds, whether it's race, ethnicity, sexuality, gender, so on and so forth.
As far as the next question we want to ask, what are some of the current sexual health resources in Champaign-Urbana and the Champaign-Urbana area, and how does one access them?
One of the a really great resource is to go to the Champaign-Urbana Public Health District website. You can find out when all of their clinic hours are. You can find out what different programs they have, and it also has links to other places. So that's a great place to start.
And of course, as someone from Planned Parenthood, I would add that Planned Parenthood is a great resource in Champaign. We have a new renovated health center that's located on 302 East Stoughton, and offer a wide variety of services for men, women, young people, all individuals that can get STI testing, they can get counseling, they can get contraception management visits, other things of those sorts that are really, really important. And Planned Parenthood's one of the many locations in the area that offer these services.
I'd like to mention RACES, which is the Rape Advocacy Counseling and Education Services that is a part of our community. It's located in the Lincoln Mall, and that provides services to people, friends, family, allies, or survivors of sexual violence or domestic violence.
I'm sorry, I could not hear where she said it was.
The Lincoln Square Mall.
Lincoln Square Mall.
Mm-hmm.
And then there's also the school-based health center at Urbana, and they do a wide variety of services there, and also have a social worker.
As a follow-up question, can I ask those of you who do work for an organization that that supports sex education or sexuality-based education in some way, shape, or form, can you tell us a little bit about the individual programs that you work with?
Well, with Planned Parenthood, Planned Parenthood has the largest network of sexuality education individuals in the nation. And so for Planned Parenthood of Illinois, and specific to Champaign, the programs that we offer are really dependent upon the requester, but we do a great deal of programs for high school age students at the schools. We also do some college-based classes, whether it's at Parkland or the University of Illinois. Really with the University of Illinois, what's been great in using our TAG program, TAG is a teen awareness group, and we have about 18 students age 15 to 18 that are trained on comprehensive sex ed and then go and provide peer education. So they're able to do that at the high school level. Usually with the university students, they're actually serving as a resource guide for individuals that are going into the medical profession or going to become social workers, to work with, discussing with those adolescents how they would like to be addressed in maybe a medical setting or a social work setting. And then we also work with our community partners just to inform them about either the resources at Planned Parenthood or other sexual health resources in the area. But like I said, it can be really dependent on what an individual request might be.
There's also the Up Center, which is located here in Champaign-Urbana, and that's a advocacy and support agency for LGBT identified lesbian, gay, bisexual, transgender identified people and allies. So that's another resource that we didn't mention. I work on a college campus, so my services are targeted towards university students, of course, because they pay our fees. So I don't do much out in the community because of that. But I will add that the services are really needed. I see a real need for education in the area of sexual health on a college campus. So students are entering the university level with a real lack of often basic knowledge around anatomy, sexuality, sexual health in general.
And the public health department too, the Champaign-Urbana Public Health Department, is not only offering some sex education specifically in Rantoul, but they're also looking at providing family service or family planning services in their health center. So they're another area that are offering services of sexual health and education in this area.
So what efforts have been made throughout the past few years to secure these programs and services? And tell us a little bit about those opportunities and challenges.
Well, I've been out of the field of doing this for about 4 years, but looking back at where I came from for the 8 years that I worked for Planned Parenthood, one of the challenges consistently is people's attitudes towards sexuality and their feelings that this is something that you don't discuss. And so, as Kim said, students come to the university at 18 and 19 years old and don't even understand their own anatomy because the programs in schools are insufficient, and because that conversation has not taken place at home. So that's always a challenge, is to come up against where people are not comfortable with the terminology or bringing up the subject, because when you say sex, people just back off. On the other hand, the opportunity, I think that the internet has provided us with great opportunities, because children and teens are seeing things and asking questions, and that gives you the opportunity to give them the correct information. So not everything you see on the internet is correct. So when they ask you questions, it's like, well, let's talk about this.
Mm-hmm.
So I saw that as a wonderful opportunity to sort of enlarge the conversation.
And that's become a really essential part of a lot of curriculums, is that they're addressing this issue of teens or young people or individuals in general accessing information on websites and how to teach how to actually access correct information and information that's medically accurate, not something that's a Yahoo answer that might have been answered by anybody that doesn't necessarily have that knowledge, but going to an accredited website or an organization that has the correct information. And
Planned Parenthood has some really great websites where they're very young adult friendly. It's like attractive and easy to click on, and it's fun, but everything is completely accurate with it.
Can you tell us a little bit about the campaign for comprehensive sex education as a localized effort?
Well, this came about, it's probably been almost 10 years ago, wouldn't you say? Because what we started to do, especially with TAG, the Teen Awareness Group, because we knew they were in the schools and they were getting some pushback by people who did not particularly want them to come in and talk to their peers about sexuality. And so what we figured out was that getting that into the schools depended on the individuals that had the classes, not on policies of the schools. And what was it that we needed to do to sort of educate people in general about what comprehensive sex ed looked like. And we came together with people from public health, from the university, from Planned Parenthood, other parents, other teens in the community, and began to sort of strategize how we could approach that. And that's how it began. And over a period of years, we met with We did health fairs, and we did something out of the park one time, trying to get into the schools. Sometimes we would be asked to come to a health fair, and then we would be not asked to come. So that's how it began.
So one of the things that we know through research is that teachers will teach based on the curriculum that they have available. And so one of the efforts through the Campaign for Comprehensive Sex Education was an effort in Urbana specifically, because their curriculum review was coming up at that time, that we worked with the Urbana School Board and the Curriculum Review Committee to look at what types of sexual health curriculum they were using and to suggest recommendations and changes where necessary. And they were very open and receptive to that. So that was one of the accomplishments of the Campaign for Comprehensive Sex Ed, was just to take a look at curriculum, make sure they had a curriculum that was based in science and evidence, sex education that works, and we moved forward from there.
And age appropriate.
Yeah.
Mm-hmm.
And we also had a training at Champaign-Urbana Public Health Department where we invited schools, just basically, I think we targeted like the principals and the social workers, and then anyone else that we thought would be interested, like the PE teachers, and we sent out invitations to come for free to this training and got people from all over the county and explained a little bit about what comprehensive sex education is and why it's important to start at an early age and move it forward. And we had a lot of really receptive, really great feedback from that. And I know some of it got kind of incorporated into some of the schools around here.
I think another challenge is that, or just a challenge along with this, has been ensuring that each school is getting similar sexuality education in the area, because it can be different between Urbana or Champaign schools even for our smaller community, that Urbana and Champaign can have completely different curriculums, and that even some curriculums could be taught differently in the same school by different health teachers.
Right.
And so a big effort that Planned Parenthood and other organizations have been trying to sponsor within the House and the Senate is a new bill or a bill that we've been trying to sponsor for a long time, but a bill to make sex ed, if taught, medically accurate, age appropriate, and evidence-based, because it's not in the state of Illinois currently. So again, we're trying to sponsor this bill, which doesn't yet have a House bill name or a Senate bill name yet, but it will, and we're hoping that it will pass this year, either in the House or the Senate. So again, that's something that we're trying to have done, but really until there's some sort of mandate with sexuality education in schools, a lot of times we will see these differences throughout the state. And if I go teach somewhere like Chicago, for example, I'll see students that are getting completely different sexuality education than what they're getting in Champaign-Urbana. Or in Decatur, which is now, Macon County is now the highest rate of teen pregnancy and STDs in the state. Out of 102 counties, the highest. That they get completely different sexuality education than what individuals get here in Champaign and Urbana. So it is very different depending on where you are, so that's why we feel like a bill like this is really critical, so there's something that if they are teaching sexuality education, there's a mandate for what the teachers need to be able, or need to be providing to their students.
One of the difficulties is that the more inaccurate types of curriculum are free and easy to get and easy to use. So one of the things that we found was we were able to let people know about other, evidence-based curriculums that were free and available, and that was appreciated also.
And there have been some restrictions for organizations or for schools saying you can use this set of evidence-based curriculum. And they're not all the same. There are some differences, or they're used for different audience types, or they're set and evidence-based off of one audience type. And so it can be different, and so sometimes that is restrictive for administrations or for organizations when they're told you can use A, B, or C, and that's your only option out of this entire list of curriculums. So that's another thing that kind of limits what individuals can do in terms of providing sexuality education.
So I'd like to ask where each of you see comprehensive sex education or sex education that works moving into the future, both on a national scale, but also maybe localized efforts here in Champaign-Urbana.
Well, I think as Corbin mentioned, it's important for it to be standardized, statewide at least, so that all teachers have the opportunity and access to the same materials. It's different, like you said, in Chicago and a small community like Cisco, what the teachers are actually going to present to their students based on their own personal preferences. If there are standardized offerings and curricula that they can have access to, then you begin to have the same information available to all of the students. Because right now it's sort of up to the individual teacher as to how and what they want to say.
There has been a lot more federal support of comprehensive sexuality education through teen pregnancy prevention funding or PrEP funding, which have been given to institutions or organizations like Planned Parenthood, for example, and other organizations to provide sexuality education. So I think in general there's a lot more awareness and discussion about moving forward with comprehensive sex ed, which in the realm of this sexuality issue, which is this huge taboo issue, it's one of the more popular topics and has one of the more, there's more favoritism towards sex ed. And a lot of people approve of the topic and feel like comprehensive sex ed needs to be provided to young people. So at least I hope that this new funding and this new awareness around this issue and motivation on the federal side will kind of help the states and agencies within the states kind of move forward with some sort of mandate or sex ed for young people and all people.
And also, recently, the last 4 years, you've seen more defunding of the abstinence-only based education, which is somewhat punitive in most cases and does not give out accurate information. So the fact that that's being defunded then puts more money available for accurate sex education.
As with most cases with the public schools, one of the things I heard the most was that teachers weren't given the time to be able to, you know, have trainings and get together and get on the same page for this kind of thing. Just like, you know, they're so stretched thin and they have so many things that they have to cover. It really is also a funding issue too, of being able to pay for a substitute so that the teacher can get the education, or making it part of their institute days. So a lot of it depends on kind of the culture of each particular unit of school programs. And I know that like Urbana and Champaign, they're, you know, more open to making room and time for those things, but everybody is just so stretched thin on time.
Which is why programs like Kim has with students who are matriculating through those programs are so important. Because if they're not trained at the college level to present it accurately, then it's up to them to get it after they graduate.
And I mentioned being a training consultant for the Illinois Caucus for Adolescent Health. Part of what that organization, which is based in Chicago, provides is training for middle school, high school teachers, and depending on their funding, some of which comes from the federal government, they're able to provide substitute reimbursement for schools to send teachers to the training. So it's a great resource, and they send trainers like myself all around the state to provide these trainings for teachers. So they pay for the training. They'll often do a substitute reimbursement and provide lunch, whatever they can do within their financial means to make sure that the training is taking place and that teachers are able to access it because of some of the challenges that Barry mentioned.
I know another obstacle that I've witnessed in the area has been, and I think that this is true for a lot of schools, is that most health curriculum are taught by PE teachers with a very high turnover rate for the health teachers. And that very rarely will I see, if we do multiple years of sex education in a school, very rarely will I see the same set of health teachers. So then even if you do at times have trained health teachers, then you don't see them return the next year because either they didn't like the organization or they were pulled and actually wanted to do physical education and weren't interested in doing health education. Now have taken on leading a sports team or coaching a sport and no longer have to do the health education component. So that's been a big obstacle, in my opinion, witnessing and trying to have retention from health teachers so that, you know, that experience that they have 1 year can carry over and they can build upon those experiences versus basically being a first-year teacher every time they teach health.
Well, at this time, I want to invite some questions from all of you who've been listening, and I'll pass the microphone around. Go to Deb.
I'm curious about the bill for the state and what it would do. My understanding with all this stretch in the schools and what they're teaching, if it isn't on the state guidelines, they're not teaching it. So somewhere, sex education, if not sexuality's on the state curriculum, or where does that all fit in? I guess I'm basically ignorant on all of that.
So administrations have a choice if they want to teach sexuality education or not. And many that do, they choose to teach, for instance, just abstinence and on STDs and HIV. And there is some mandate in place that if they are teaching sex ed, that they should cover abstinence, HIV, and talk about heterosexual relationships.
That's in the Illinois school code.
Yes,
Yeah.
right, thank you. And this new mandate would say if you are teaching sex ed, which doesn't mandate that they do teach sex ed, just if they are teaching it, that it needs to be comprehensive, medically accurate, and age appropriate. And that would be based, the administration would have to make sure that that were being enforced based on that.
Thank you. When the Urbana School Board adopted the curriculum suggested by Campaign for Comprehensive Sex Education, I think it was 6 years ago this week, if I remember. I know it was in February, it was cold. Anyway, that night, after the board voted on it, I don't know if he was president of the board at the time, but John Dimmitt, one of the board members, said to us in the audience, you need to understand that Urbana School Board does not impose any requirements on teachers, so no one has to do this, but this is our established curriculum. And as recently as 2 months ago, I spoke to an Urbana high school student who said, in fact, that in their health class, they did not have any discussion about whatsoever about contraception. I have not heard very recently about the teacher that I heard about a few years ago telling students condoms don't work. That was the extent of their explanation about birth control. So I'm wondering, especially since the state law still doesn't mandate it, what can the League of Women Voters do as an organization? What can we all do as individuals? What can we take back to other organizations we're involved in? What can we do to get the local schools to require every teacher who teaches health class to teach a comprehensive sex ed curriculum, especially now that the materials are available, that the Mental Health Board made the money available to Champaign-Urbana Public Health District to get out those, I forget what, it was OWL and something else, but those two things that you mentioned. So the materials are all there. They can't say it's cost. What can we do, pardon my use of the language, but to make them do it so that so it's not just hit or miss that your kid gets education if they happen to luck out and get the right teacher. Any ideas?
Good question. Not sure I have the answer. I think that if there were things that we could do to make things happen, it would be done. You know, that there's reasons why that's not feasible, not possible. I think some of the challenges that both Corbin and Barry talked about in terms of training, consistency in training, time, meeting other requirements, being stretched too thin. I mean, those are the realities that teachers have. Things that I hear from teachers across the state include things like, I would love to implement the newly released national sexuality education standards that go from kindergarten through 12th grade with a number of bullet points that show kind of competency areas throughout a child's education. Unfortunately, the reality in schools is that most teachers get 5 days to teach sexuality education in maybe 7th grade and another 5 days or 5 units in 9th or 10th grade. And so to try to implement something as comprehensive as what the national standards are calling for really becomes very impossible.
Well, about implementing it, I guess my message is, where's the pressure point? Because it seemed like the school board, at the time, it seemed like that was the right place to go, but it turned out that wasn't. I mean, should we be going to principals? Should we be trying to get the PTA to do it? And if so, where should they be putting their pressure?
It needs to be the curriculum directors. And I had no idea how long the process took in order to get a new curriculum going. There needs to be a champion, someone who's really behind it in the school, and they need to be there for quite a few years, yeah. And then at the time that that's all finished, it just also depends on if the funding is there to implement the curriculum. But there, now that I understand, like, there's like X number of steps just to get a curriculum put together, or just to get the outline for the curriculum put together. And then once it gets approved, then you get into the development stage. And then once it's in the development stage, that has to be approved. There's just so many steps. And I think the main thing is to keep supporting the people who are trying to put standards through, and also to keep bringing it up and mentioning it and saying, hey, what's happening with this? We haven't heard anything. Because I do think that administrators listen to that.
I think the answer to your question, Esther, is yes to all of the above.
You get them all?
Yeah, because if parents are adamant enough that they want this in the schools, they can put pressure on their, they can talk to PTAs and talk to their administrators. As we found out, even though the curriculum suggestions were made, the teachers still have the final decision as to whether they want to follow those or not. So if there's no pressure from above or below, they continue to do what they're comfortable doing.
Mm-hmm.
And I would also add, and I don't think that this answers that question either, but we know that this bill that is being proposed is not, it's a step. Mm-hmm. It's a step. It's not the full perfect solution to the problem. Perfect solution is having a K through 12 recommended national standard of education for students, which has been recommended by professionals, many professionals, and peer-reviewed. But if we can take a step towards having some sort of mandate for those that are teaching sex ed for it to be medically accurate, age appropriate, and comprehensive, then the next step is saying, okay, now we need to make it required. Mm-hmm. So it's a stepping stone. So being an advocate for bills like this and bills that support sex education and making progress is really essential. So contacting congressmen and contacting bureaucrats and individuals in the communities that we can try and get some advocacy for a bill like this, I think is a really, really essential step towards going to that next component.
Wanted to ask, is that off? It's on. Okay. Are there grants available to help compensate for the cost of comprehensive education, sexual education in the schools?
There are grants available for evidence-based curriculum, and many individuals and many agencies have earned those grants, like public health, for example, who are teaching a comprehensive or evidence-based curriculum in the Rantoul schools for middle schools. So there are individuals for Planned Parenthood in Chicago, we're doing a TOP program, which is like a youth development program, which has some sexuality component to it, but that was another grant-funded program. So there are individuals throughout the country that are getting grant money to do some sort of sex ed.
In all your work, do you find a lot of public resistance against the programs, or do you find that really that there's a lot of support and it's just the sort of bureaucratic situation, the curriculum situation, that causes a delay in getting something really happening? I mean, there's, if you see what I mean, about resistance. Mm-hmm. Mm-hmm. If you could speak about that, as far as you might be experiencing it.
I think in communities where the education level is higher, where parents are more aware, it's easier. Mm-hmm. When you're in more rural communities and more outlying communities where it's not as easily discussed, you find the resistance to be a lot higher. Where you've had the same teacher in the same position for many, many years and they've kind of got their set routine, it's a lot harder to move them one direction or the other. So it just depends on the attitude of the particular school district and the administrators. School districts are very autonomous and they get to call the shots for their own district. So it's a multifaceted, multi-layered approach when you try to change these kinds of things.
One thing we found when we were doing the campaign was that people were surprised, consistently surprised, at the lack of education that was happening in Champaign-Urbana itself. People assumed it was being done. And to find out it wasn't was a surprise for them. I wouldn't say that we've had much resistance at all.
No.
And again, like, it so varies even from school to school within a district. So, you know, I forgot to introduce myself as a parent of a 16-year-old. And he had a whole semester of health at Central High School, and he had a fabulous teacher. And he came home and he told me, because I was paying him, he told me all sorts of wonderful things that they did in class. And it was, you know, my ideal. But I also know that, you know, not all the kids got that health teacher, and not all the kids go to Central. So.
Thank you very much for a good program. I have a couple comments and then a question. One is I want to hold up or shout out the TAG, Teen Awareness Group peer training. My daughter was in it a few years ago here locally, and it was extremely well done. I was very impressed with not only the level of the training that she got, but also what they did in the community. I mean, it was just very profound and very, very positive and effective. So thank you for that resource. The second comment I want to make is I'm on the Urbana School Board, and I just want to reiterate what others have said about the difficulty in getting new reforms or new curricula through our schools. I mean, the sheer magnitude of expectations on our public schools and teachers is just, I mean, it's mind-boggling and grows all, you know, yearly without lengthening school day or school year. So, I mean, that is an enormous challenge. Now, but my question is, I guess for those in the audience, and I don't mean necessarily sitting here, but our listening audience, who are reluctant about pushing through comprehensive sex education in our schools, can you speak a little bit to what is the consequence to young adults who do not have access to comprehensive sex education in their schools? I mean, what do you see on college campuses or young adults who are out in communities? What are their lives like when they don't have access to good sexuality education in their younger years?
Well, I think that in general, we can kind of look at areas that don't have access to comprehensive sex ed. The numbers show that there's higher risks and higher rates of STI transmission, sometimes higher rates of HIV transmission, unintended pregnancies. And that's only, you know, what we see in terms of a public health standpoint or public health data. But comprehensive sexuality education is evidence-based, and we've seen the evidence which tells us that effective programs help teens delay their first act of sexuality, or not sexuality, I apologize, sexual activity, whether it's vaginal sex or anal sex or oral sex, that it can help them delay, that it can build some personal skills, some decision-making skills, or some negotiation skills, skills that are not only applicable to them as sexual beings, but as individuals, to negotiate relationships, to understand their personal identity. Things like that are not taught very often in schools. So it's more than just, and I think that sometimes we get hyper-focused on the fact that it's sexuality education, but if we think of sexuality as something that's integral to our personhood, a lot of those concepts overcross those personal skills, understanding oneself. It's not just about that one component, although that's really core to it, it's more than that. But for those, I think, that are on the fence about it, I think it's really important to show and to share that this is not just a curriculum that's been developed and that we want to try it out. This is curriculum that has been developed and has been tested. Some have been endorsed by the federal government, saying that this is an evidence-based program that the CDC approves of. And it has that kind of note of approval from the CDC. Now, that's not to say that there are programs out there that don't have the CDC's approval that aren't excellent programs. But I think for those on the fence to understand that it's not just a program, it's based in science is really, really important to add to that.
To follow up on that, the research also shows that when the only message is don't do it or to abstain, young people will delay by a few, maybe 6 months to a year, but when they do ultimately engage in activity, they're more likely to do so unprotected and to not make decisions to help reduce their risks or to help protect their health. And so that research is pretty clear. So I think that's a huge consequence when the only message is to abstain, that they're not getting the information that should follow up with that. When you do decide, or if you do decide to engage in sexual activity, here's information about contraception, pregnancy, STD prevention, to help you make good decisions to protect your health.
Regarding the resistance from different school districts to allow sex ed or sexuality to be taught, do you find that some of the resistance is coming because there are parents that feel like it's their role as the parent of the children to educate their children on sexuality and sexual education? So just like to hear your thoughts on that.
Having the son who just went through, they send home information beforehand, and if you don't want your child to go through it, then they don't go through it. They just go to PE. It's very straightforward and clear, and I think pretty much every good program has like basically letters that get sent home on, this is what's going to happen. This is who you contact if you want to opt out of this. So you have a lot of say as a parent. It's not so much resistance, I think, from the schools as not having the time to get to do it, not having, and I think when we do see resistance, it's from individual teachers in the school because they're uncomfortable, they're not used to it. And that was one thing we really tried to do with the Campaign for Comprehensive Sex Education, was to let them know that they don't have to do all of it, that there are resources in the community that will come in and do different parts if they're not comfortable doing that. So that's another resource, another thing we tried to point out. But I don't really hear, I didn't hear any complaints from any of my peers who had children going through the sex ed classes that had any issues with it. Of course, that's a very subjective, small sample.
I was wondering about the communities of resistance. Haven't heard anything to the effect that you're talking about any attempts to have dialogue with them. Surely a lot of the indices that you're going after with your evidence-based research tie in with goals that they have too. They want to delay pregnancy, they want to have a reduction in STDs, all of the rest. And it seems like if you could focus on the common ground and have an effort, you'd have a lot less resistance for what you're trying to do.
I think that, just in response to that, I think that would be great if that conversation can happen. The venue or the avenue is not always present as we would like it to. And I think a lot of that, part one of what I'll say about that is that there are still very limited resources, even on the comprehensive sex ed side, in terms of where can we focus attention, time, staff, and ability. Resources are sometimes very limited. And another kind of idea that I had just about that comment was misinformation sometimes from administrators or from other staff that might think that abstinence-based education is the way to address those issues. And they haven't seen some of the results or the findings from evidence-based education like Kim was talking about. And so it could just be misinformation and miseducation of individuals that think that they're maybe approaching something in the recommended way, when comprehensive sex ed, more than anything, has been more evidence-based and approved by different organizations, including the CDC. So sometimes it's just finding the venue, and then it's educating the individuals that are making those policies, which is not always very easy.
Could you say, excuse me, could you say a little bit more about the Rantoul program? I think you said it was the middle schools. How you got into the Rantoul schools, or just like to hear a little bit more about that.
When I worked at Public Health, and I've been gone for 3 years from there, but I was there for 5 years before that, and their middle school is Ader Middle School in Rantoul that all of the kids go to, and it just happens to be just down the street from where the WIC office is. So there's interaction, and I also had clients that I was working with that were at Edison Middle School. And I think almost in part because there's not as many resources up there to access, that they're willing to seek it out more. And also when I was working with this, they had some very young girls getting pregnant, and it was frightening.
And they're doing in Rantoul, they're doing a curriculum that's called Draw the Line, Respect the Line, which is made for middle schoolers, so 6th, 7th, and 8th grade. So, it's a fairly intensive program, and they get a lot of information. A lot of it is about understanding and digesting their own personal values and boundaries, and being able to say no in different situations. It does include some comprehensive sexuality component, of course, but a lot of it is about understanding and building some social skills or personal skills to either say no or to negotiate or to communicate more effectively. So like I said, those are happening for 6th, 7th, and 8th graders. And just going off of what you said in terms of resources and sexual health resources, I think that's been a large problem in Rantoul. Mm-hmm. And what's been great is that public health is able to offer this program, which I should add is each program has one of my tag students in it, so that they have a young person in the classroom that is helping guide some of the topics and some discussion and helping out with that class, which is really nice for them to have a youth representative or a peer educator there. But also public health has been able to take the Teen Wellness on Wheels bus out to Rantoul High School to do testing and to be a resource, a public health resource for those students that don't have, like Urbana, a school-based health center.
At the beginning of your presentation, I was hearing terms like state guidelines and a push to make comprehensive sex ed requirement. But then I'm hearing about Central and their decision to make it possible for a student to opt out. So my question is, how can something become a requirement and yet students and parents have an option to not take advantage of this?
Again, I don't know a whole lot about these, but I know that there are students who do not, who are able to come to school even though they haven't gotten the vaccines that need to be obtained because of religious reasons. So I'm not sure, but I know that there are other situations where that happens.
And to add to that currently that if they're teaching sex ed, there's a certain mandate that they have to meet, saying that they're talking about abstinence, HIV, heterosexual relationships. But even with that parents can have their student opt out of that curriculum. And am I correct in that? Sorry.
You are correct, and sorry, I keep
No,
jumping in on
fine.
you, Corbin. But there is actually, in one school in the state of Illinois, it wasn't locally, where a parent opted out their child because it wasn't being taught in an inclusive manner, because the Illinois school code. So I did hear a story of that from a health teacher, which I thought was really cool, actually, that the parent said, no, you're teaching an abstinence-only message. It's teaching respect for heterosexual marriage, which is all stated in the school code. And they opted their child out because of it. Just sort of a different approach.
That's great.
Sorry to interrupt you.
No, you're fine. You're fine. And I would add that this current House bill being proposed, that it still allows for a parent to have their child opt out, or a guardian to have their child opt out if they want them to.
So is all of this initiative geared to the public school system? And if that's true, then what about students who are in alternative kinds of education programs like homeschooling, private schools, schools that are designed for students with particular needs? What about them?
I think there's a little bit of I don't think we were very clear on the fact that there isn't a current initiative as far as locally with the Campaign for Comprehensive Sex Education. It disbanded a few years ago because at that point we had kind of, we thought, gotten as far as we could with where we were at, and we had gotten a lot of information out there, and there seemed to be less of a pending need. Help me out, guys. Is that? So as far as there being like a concentrated effort here and us representing that. We're just talking as people who are knowledgeable in this area, in this community, and in statewide and nationwide. But public health and Planned Parenthood have libraries available, and they don't discriminate. You can be public, private. There's all sorts of resources and information that anyone can get.
I have to follow up with a shameless plug. I didn't mention that I also teach Our Whole Lives, the OWL curriculum at the Unitarian Universalist Church. And the OWL curriculum was actually developed in concert with the United Church of Christ. And so those two organizations came together to build that curriculum. And it is designed to be comprehensive and then throughout life. It begins with young age curriculum and goes all the way into adulthood. Right now, I'm particularly teaching 8th grade OWL curriculum. We do have, I think, one 7th grader in the course. But it's taught with a number of different folks together. And we also do a sort of review of the curriculum. It's open to the public, so you don't have to be UU, you don't have to be UCC to actually attend OWL for the year that it's going on. And we try to stagger and offer different age levels and grades. Oftentimes we do it based on our own congregation's needs, but we like to open up and invite that to other folks. And I think there is a distinction sometimes between mandating or encouraging a mandate around whether a school offers comprehensive sex education versus whether or not somebody's obligated to take it. And so one of the things that we do, particularly with the OWL curriculum, is we have a parent orientation where the parents review the whole curriculum. They see the visuals that we would show in the course, any DVD, anything that we would possibly show, they approve and sign off. And they can actually approve certain parts, so they can say, if they chose to, I approve these chapters or I don't, or I approve the actual curriculum, but I don't approve any visuals. So when there is visuals shown, I'd like my students leave. All of those things can happen. And so far in my experience, I haven't seen anything of that happening. I think the parents really appreciate being able to see. And one of the things that I hear a lot of the folks on the panel talking about is sort of the move towards a type of education that is largely inclusive on the basis of race, ethnicity, gender, sexuality, religion, spirituality, all these sorts of things. And I think that what's really nice about OWL is we see a large representation of diversity within the curriculum, which is really nice, and beginning from a young age, so sort of teaching that diversity and teaching sex ed as teaching consent and these sorts of things that also help prevent sexual violence in the long run.
Just one question about semantics. When I was teaching, it was sex education. Now I hear you saying sexuality education, and I know there's got to be a reason for the change in lingo. Second question, sort of semantic. Comprehensive sex education, because it includes sort of all points of view, background, or are we talking about something that is a K-12 situation? Is it comprehensive in that sense? And then my third question is, is there a place where we could go just to take a look, I'm sure we can go to the web somewhere, just to take a look at sort of a model curriculum that's, quite well respected. I'm just curious myself to take a look at that. Because I would imagine in the ideal world, this would be starting in kindergarten in a way, right? And going all the way up, rather than this let's squeeze it in 7th grade. Because it seems like the most, what can I say, if you could do nothing else, but for heaven's sakes, let's get to those 9th or 10th graders, because this is, we got to do this, right? But in an ideal world, I bet there are earlier, places along the way. So I guess the two semantic ones first, and if you get to the other.
So I would say, in terms of the first point that you're making, sex versus sexuality, and it kind of goes along, I think, with the second point too, that we're not just teaching about sex, we're teaching about sexuality in a more broad aspect, and that we're teaching everything about the sexual being, about intimacy, sensuality, sexual health, sexual identity, sexualization. That it's not just one area, that we can't pick or choose to teach abstinence or STDs, that if we're teaching about sexuality, we need to teach about everything. and that we can't just pick one area and then kind of ignore the other things, that it has to be all-inclusive. So I think that from what I've seen, that comprehensive has a lot of times, at least in my experience, talked about teaching everything about sexuality. I do think that that you can kind of look at another access and say that it needs to be all ages as well. So everything and for all ages, because it is different depending on what age you teach. And that's why these national standards that are suggested, and again, these are just suggestions that say that we can divide it by grade types, so K through 2nd, 3rd through 5th, 6 through 8, and then 9 through 12. These are the standards that they should reach by the end of that time frame and should understand at that age.
So for example, the K through 2nd portion is very much about safety and about support systems and who you go to if you feel uncomfortable, if something doesn't seem right. It's really about how this is your body, and you own this, and there's certain rights that you have with your body. And that's really, the basic of what those early years are. So it's not, by saying sex, it's really not very accurate.
And in terms of, in terms of just resources really quickly, I would say if you just Google Office of Adolescent Health, that they'll show you what evidence-based curriculums are available right now and give you a good breakdown about, depending on what curriculum, like I said, Rantoul is doing Draw the Line, Respect the Line, that someone could kind of see a breakdown of what's taught, what lessons are available based on the age. Also, etr.org is an organization that is a publisher for a lot of these evidence-based curriculums, and that you can see a little bit more specifics and breakdowns about these curriculums and what they offer.
There's a curriculum that's available online. It's called FLASH, F-L-A-S-H, and you can access that curriculum online. I forget the exact acronym of what it stands for. I think it's Family Life something, something, something. But somebody asked a question about other populations outside of the public school, so that's an online curriculum that people can access, and FLASH also has a curriculum that's designed for young people with disabilities as well, so sexuality with disabilities. I would Google FLASH curriculum and see. I don't know the exact website on that.
And I always add in it's in King County, Washington, and that usually helps me kind of narrow my my search for it.
Yeah.
And it's very user-friendly. So like if you're homeschooling and a certain topic comes up, you can target that topic very easily through the FLASH program.
So I have to say, folks, we are out of time for today, so I hope you'll join me in thanking our panelists for being here and sharing this information with us.